Okay, so hopefully we have down pretty well that atria receive blood, ventricles pump blood out. There is a difference. So notice there's an obvious difference that the left side of the heart is pumping oxygenated blood. The right side of the heart is pumping deoxygenated blood. So that's what we're using the two colors to differentiate. Now, technically, deoxygenated blood is not blue. It's more of a deep kind of maroon red, but that would make it pretty tricky if we used a deep red versus a bright red. But this right side of the heart's pumping the deoxygenated blood, so it gets deoxygenated blood, then pumps it out to the lungs. The left side of the heart gets oxygenated blood from the lungs and pumps it out everywhere. So there are some major differences here. The type of blood is the number one difference between the right side and the left side. The other major difference is pressure. So the left side of the heart has to generate much higher pressure than the right side. And that's because the left side of the heart is pumping blood everywhere, all right? Not just to the lungs like the right side. So if you're pumping blood everywhere, we're talking up to the brain, down your arms to your fingertips, down the legs all the way to your toes, there's a lot of resistance to that blood flow, all right? And when there's a lot more resistance due to the distance that blood has to travel, you have to apply more pressure to that blood. So if we were to cut transversely through a heart, all right, remember a transverse plane is horizontal, we would see that the wall of the left ventricle is much thicker when it comes to the right ventricle, all right? And that muscle, that thicker muscle, is in an effort to generate a much greater pressure to drive that blood, to push that blood through the systemic circuit. So notice the left ventricle, longer distance, right? That systemic circuit is a longer distance, more resistance. Resistance is an opposition to blood flow. It makes moving blood harder. So we have to produce more pressure. So the pressure will get up to, say, 120 millimeters mercury. That's a unit of pressure. We're going to use that quite a bit this semester. It's just a unit of pressure. 120 is that high pressure that left ventricle generates. Then it might go down to 80 when it relaxes. So that's that 120 over 80 for blood pressure. So you need more muscle. Oops. On the right side, shorter distance, right? You're only pumping blood to the lungs, and they're right on each side of the heart. Shorter distance, less resistance, less opposition, so you don't have to generate as much pressure. So the right ventricle gets up to, say, 25 millimeters mercury, where the left ventricle has to get up to 120. So you don't need as much muscle. So that explains the difference between the left and the right ventricle. Okay, now we're going to add in valves. So the general function of a valve is to prevent backflow, but we have to look at the location of the valve and thus where are we preventing that blood from going. So you've got 4 heart valves. 2 of them are called atrioventricular valves. And that name comes from the fact that they lie in between an atrium and a ventricle. All right, so one here and one here. Those are the 2 atrioventricular valves. What they prevent is blood from going from ventricle up to atrium. All right, we want blood to go from an atrium down to a ventricle and then out of the heart. We don't want it going back up into the atrium. So that's the function of AV valves. The function of the semilunar valves, so those are these guys here and here, is to prevent backflow from the artery back into the ventricle. So now we can prevent blood from going back into the atrium, but also prevent it from going back into the ventricle. Therefore, we keep the blood moving in the proper direction. Okay, so let's learn their names. I always start with AV valves. So the AV valves are down here, right? They're in between the atrium and the ventricle. The AV valve on the right side of the heart is known as the tricuspid valve. Cusps are the little flaps. All right, so these you can see that there's flaps here, but you kind of have to use your imagination. The tricuspid valve has 3 flaps. The bicuspid valve has 2 flaps, or cusps. So the tricuspid valve opens when pressure in the right ventricle is low. So when the pressure in the ventricles drop really low, you can fill them with blood. So that valve is open. Once the ventricles contract and the pressure goes up, you're going to force blood one of 2 ways. You're either going to force it out of the ventricle into the artery, which that's what we want, or you could potentially force that blood back into the atrium. So immediately when the ventricles contract, we close the AV valves. We close the tricuspid and bicuspid valves. And you actually can associate a sound with closing of those valves. So the turbulence of blood produces a sound. We call that the S1 sound. So when you think of the sound of a heart, we typically say it's a lubbed up, lubbed up, lubbed up. Well, that first lub sound is due to the turbulence that occurs when the AV valves close. All right, so lubbed up, lubbed up. The dup is when the semilunar valves close. Okay, so those are the AV valves. Let's take a look at the semilunar valves. Now they're called semilunar because the little cusps to someone look like little half moons. All right, now you can't tell that from this angle, but these are actually have 3 little cusps and they all look like little half moons. So what is the function of the semilunar valves? When blood is pumped out of the ventricles, so pumped out of the right ventricle into this pulmonary trunk, pumped out of the left ventricle into the aorta, you don't want the blood to go back. So these valves must close after blood is ejected. All right, and when they close, you can hear that as the S2 heart sound, or the dup. All right, so we have the lubbed up, lubbed up. So notice the pulmonary valve. When the ventricles contract, pressure increases, opens the valves. Then when the ventricles relax, that drop in pressure closes the semilunar valves. So we have the pulmonary valve inside what's known as the pulmonary trunk, and we have the aortic valve inside the aorta. All right, both of them preventing blood from going back into the ventricles. All right, let's take a look at these valves a little closer. So notice that we're looking just at the left side of the heart. So this makes it, we're trying to make things a little simpler to look at. You can kind of imagine the same thing is happening on the right side. So notice in this situation, we have valves positioned in the way they will be when we're filling a ventricle. So blood is coming from the atrium, this is the left atrium, through the bicuspid or mitral valve and fills that ventricle. All right. Notice when we're filling that ventricle, we don't want the semilunar valve open. All right, we want that one closed. The moment that ventricle contracts, we're going to increase the pressure in this ventricle. And pressure moves blood. But blood's going to have 2 options. So to prevent this option of going back up into the atria, these cusps close up and prevent that blood from going up into the atrium. The semilunar valve opens and allows the blood into the aorta. So this is in essence how it works on both sides. We open the AV valve so we can fill. We close the AV valve, then open the semilunar valve so we can eject blood. Sometimes they don't work, and you get heart valve defects. Notice that you have to be pulling and holding on tight to these cusps. Notice that this pressure is really putting a lot of pressure on these valves. All right, these cusps here of the mitral valve. So each AV valve, both the mitral valve on the left that we're looking at and the tricuspid valve on the right, have some accessory structures to them. They have little muscles called papillary muscles that are attached to little tendons called chordae tendineae. That means cord-like tendons. And when this ventricle contracts, so do the papillary muscles. And that contraction makes those chordae tendineae go very tight. And that holds on to those cusps. Notice over here you don't have to. All right, they don't have to hold on to those cusps because we want them open. All right, so those muscles relax. That helps allow that valve to be open. And then we contract the little papillary muscles to basically hold on tight to these cusps. If that doesn't occur, if these are loose, you could get what's called prolapse of the valve. All right, so these papillary muscles with their chordae tendineae help to anchor those AV valves, prevent prolapse. A very common valve problem is prolapse, and it tends to happen with the mitral valve. All right, mitral valve prolapse. Now, why the mitral valve? Because of that high pressure on the left ventricle. Remember the right ventricle, not as much pressure. So there's not as much emphasis on holding on really tight to those cusps on the right side, but it's very important to hold on tight on the left side because of that high pressure of the left ventricle. So study these images. Notice that this mitral valve is open, all right, to allow filling of the ventricle. Notice over here it's closed to prevent backflow. Notice over here the aortic semilunar valve is closed. Over here it is open so we can pump that blood through that valve. Here's just another view. I kind of like this view. I took this from a different textbook. We have to kind of understand what we're looking at. We've cut through all the valves, so we've basically removed the upper atria, and we're looking down at the valves. This is the front of the heart. This is the posterior of the heart. In this situation, blood is entering the ventricles. So it's coming down from the atria through the valves down to those ventricles. So notice this is the tricuspid valve open. This is the bicuspid or mitral valve open, and we are filling those ventricles. Notice while we're filling, we keep the semilunar valves closed so the blood doesn't leak out of the ventricles. So open AV valves, closed semilunar valves. In this situation, we're pumping blood out of the ventricles. So we see that the pulmonary valve is open, the aortic valve is open, but we close the tricuspid valve and the mitral valve. And then I also like these images because you can see the cusps a little better. So notice here's the tricuspid valve with its 3 cusps. Here's the bicuspid valve with its 2 cusps. Notice over here, these are the semilunar valve cusps. So notice, I always tell students, put 2 of them together. Right? If you put this cusp together with that cusp, you get this kind of crescent-shaped moon. So that's how they got these semilunar names for those valves. So then the question is, where did they come up with mitral valve? I'm going to leave that up to you. So you're going to have to Google mitral valve and try to figure out why the bicuspid valve is also known as the mitral valve. What are some things that could go wrong? We talked about prolapse. So prolapse is when the cusps, in particular of the mitral valve or bicuspid valve, get pushed up into the atria, and that's going to allow backflow or regurgitation. There could be stenosis of a valve. Stenosis is when the valve is narrow and it'll restrict blood flow through it. So maybe this area here is narrow and you can't get as much blood through that narrow valve. It could have insufficiency or incompetence. So that's when it fails to close completely. So you could have kind of a failure to open enough in stenosis, or a failure to close completely in insufficiency or incompetence. And there's a lot of treatments. We could kind of stretch open a narrow valve. They use what's called balloon valvuloplasty. They actually use a little balloon to inflate the balloon and kind of stretch it open more. They could do some surgical repair, or we could do a valve replacement. And there's a lot of different options when it comes to replacing a valve. All right, so those are the valves. That's probably a good place to kind of, again, take a little break, add the valves to your puzzle, and then we're going to pick up with the great vessels. So learn, what blood vessels bring the blood into the atria, what blood vessels bring the blood out from the ventricles, and then we're going to put it all together and go through the entire heart.